See, when you go through that stage in your life, and we all know family members, friends who have gone, when you hear the word cancer, you don't hear anything else. You're mute. And you just, where do I go? Where do I go next? And the next thing you know, you're in this queue, and you're essentially not able to think, because all what you're thinking, it's like learning Chinese. You know, it's a new language. What's the standard? Or you just go here and this is what happens next, and you just kind of are true. Now, if you remember, one of the things that I mentioned initially was the audience here is the patients who have implants. The audience is the significant others who are, because living with and will eventually live with their spouses who are going to have implants. And third, you know, there was a high school student asked Jennifer, who wants to come and shadow me. She's here for summer break and she wants to shadow. I said, come here. I only have one request. I'm going to ask my patients if you can come in and listen, but you have to do one thing. You're going to write about breast implant illness when you go back to college, because I wanted to teach your friends what you saw and learned from just one day. And she's like, wow, I didn't know this. Now, I'll tell you this, she will never get implants in her life because she heard the patients directly. And she was, and I said, you know what, when you go back in your college newspaper, what was my summer? Write an article. You know, it might touch someone, and that one experience might be someone's misery prevented. Yes, please. Can you please do me a favor? If you can come and talk, that would be great, and I appreciate it, because I have, you know, we have an audience that is international, that is all around, and who will listen, so we want to share your experience, please. Thank you very much.
Yeah, my implants stole almost 26 years from my life. I was told they were safe. I had saline, so I thought, okay, I did the right one, you know. And I had probably 40 to 50 symptoms. Everything from I couldn't get off my couch, to depression, to, oh my gosh, I could go on for hours. And that's not me. I'm the Charge the Hill girl. I run my own business. I do all kinds of stuff. And I had so much pain. I had weekly or twice weekly migraine headaches. I was like you, I eliminated so much out of my diet just to try not to have headaches. In the 7.5 weeks since I had my implants out, I haven't had one headache, not one. It's taken vacations from me. It's taken time with my children. I lost 12 pounds, like boom, like the inflammation was amazing. I feel like I'm 61. I feel like I'm 30 again. And I wish I would have known about you. And I will tell so many people about you being here in Michigan, because the doctor I went to in Nashville was awesome. He was a microsurgeon, and definitely go to a microsurgeon because they're definitely worth it. So definitely.
Thank you very much for sharing your experience. And so this is, you know, you asked a very smart question at the end, how can we change? She just made a change because she got up and she talked about her experience, because what she went through right now, that's her life. It's very real. 26 years. Who was president 26 years ago? Long time ago. Yeah. So, you know, so this is like, I'm assuming the Clinton time. You know, so the you know, that's how old this, what you lived with, and this is what the whole point is. Now, you made a huge impact right now, because someone in another part of the world is going to say, you know what, that's exactly what I was experiencing. And I was a productive part of society, just like Tracy said. And I will tell you this, I could have gone, if I was in the 70s and 80s, as a plastic surgeon, gone on my whole career not putting an implant. Now, all of a sudden, I was doing a lot of good reconstruction. All of a sudden, patients would come, I would do the explant, not talk about it. I just made my YouTube channel like 2.5 weeks ago, thanks to MPH right here. They've been taking care of me and getting the word out. And they basically, I post a video on the 1 in the morning, it's there at 3 in the morning, it's posted. They take care of, and you know what? Together, all of us will make the change. Now, I will tell you, you just need to keep talking. Hopefully a seminar like this, I'm going to go and I'm going to reach out to my other explant surgeons exclusively. There's another doc friend of mine in town. He's not put a single implant in. And he's, again, the same thought that he said, I would do something else because I don't believe in it. You know what I'm saying? I don't want to do no harm. I will tell you, it's very easy to put in implants. As you see, dermatologists are doing it. OBGYN docs are doing it. Hair transplant surgeons, general surgeons are doing it. And the point I'm trying to make here is it's not as simple as putting an implant in and have a nice life and live happily ever after. That's absolutely not the case.
Because more and more happens, and hopefully FDA things start coming about.
Right, yeah.
I mean, more people are getting educated all the time, and I just hope that more and more people will show up to these kind of things.
Right. There is, from my experience, if you take my general surgery part of the training away, I will say I'll deflate when it comes to my training. When there was a patient that, and again, I'm going to speak my mind, as you probably know and realize, a gunshot wound to the chest. All of a sudden, you have to do the protocol, take care of business. There were friends of mine who were saying, what are you going to learn from that? I'll tell you this is coming into play right now because I can dissect off the chest wall. Number two, being able to, I gave the example when you have bowel adhesions and you have to be very meticulous. I loved the thyroid surgery because you have to be very precise. One bad move on the thyroid, you could end up in a hematoma on the neck. Or you're off by a little bit on hand surgery, and the next thing you know, the patient has permanent ligament damage. So it's all about defining the right tissue plane, as you saw. If you look at the videos, making the right dissections. When I do the nerve repair, artificial cadaveric nerve reconstruction because the patient had a tumor, you bring the scope out and you connect with 8-0 nylons, same meticulous dissection, and you're offering that experience to the patients with the capsule because, again, the take-home message is the capsule needs to go.
Renee wants to know if pathology comes back with bacteria or fungus, do you offer a treatment?
100% infectious disease. They need to jump on the patient, and they need to basically make sure that when they grow the bacteria on the petri dish, that it is susceptible to the antibiotic that you're going to give that's not resistant, and that you have a definitive infectious disease. And they do bugs all day, microorganisms, resistant, special bugs, fungal infections, TB. When that one patient in my training who had the TB, infectious disease was the next consult. They jumped. You have to treat like you would indolent TB because we don't want a recurrence. So you have to get the right appropriate team involved so that we can tackle the microorganism accordingly. So normally, I will tell you this from my experience, I don't like to book 6 months out or 3 months out. Every patient that comes in, Jennifer, she walks up to me and she says, do you want to see this patient? And I say, yes or no. I work almost 100 hours a week. And I will tell you, the day before, I slept at 4:20 just because I had to take care, present, make sure everything was good. Ask Lori, I'm behind in billing for 2.5 months for my other, she will tell you. And so, I have a full life. The point I'm trying to make is I'm working. I don't want to see a patient, and the next thing you know, I book them 4 months, and when I see them again, I'm like, so where were we? I want to have a fresh image, a fresh picture, so that when I offer the service, I'm able to offer definitively. So I say I block at 3 for 2 reasons. So 3 is a very healthy number if I start at 8:30. So I've been doing consecutive 3 to 3 on a Tuesday morning. I don't like to operate on Fridays or the weekend. So earlier on in the weeks, just so that if there's any issues, anything, I'm there to take care of it. So 3, and I will tell you if any explant surgeon is offering and they're done in an hour, hour and a half, there's a problem there. So one day, yeah, yes. Right. So to give you an example, like today I did 5 cases. These 6 cases. And so this is and enough. And Jennifer, you should have seen me. She was like, "You better be on time here." And I had to do another surgery, but we ended up putting it on for Thursday morning because that's the reconstruction I have to do. So I will tell you, when a person cancels, I'm like, thank God I'm going to go home.
But these were all minor procedures, they weren't.
Right,
they
right.
weren't
I was gonna
anesthetic
say.
procedures.
Yeah. So I had,
They were anesthetic procedures he did today.
right, right. So just to give you an example, I do all sorts of reconstruction. This is what I was doing, like Integra reconstruction, which is artificial skin squamous cell cancer. I did a carpal tunnel on a physician today, basically under local, no general, no sedation. The third one was a lesion, what was potentially melanoma, on the breast of a lady. She came referred by a dermatologist. The fourth one was, and again, these are, I had a extensor tendon that I did. Again, very meticulous, sophisticated surgery, hand surgery. It's very delicate. I say if you can do hand, you can do everything. The hand's very tricky.
Dr. Khan,
Yes.
there's a couple basic questions that people had.
Yes, please.
For example, how soon can they drive after surgery? Will they be able to lift, like activity, right after the explant?
Sure. So that's a very good question. So it matters on where the implant sits, above the muscle or below. Now, this was one of the remarks I was on the Live in the D Extra, and someone's like, "Oh, my guest was on TV and she's driving day 3 and giving an interview." That's like, no, we have to look at that patient, and some of the patients did comment on the internet. You cannot just conclude from that what happened. There's a whole story and series of events that led to that, surgery and post-op. So to answer the question, if the implant is below the muscle, it's not ruptured and doesn't have a capsule, and the dissection is, now there's different ways you can put behind the muscle. You can put with alloderm, for example. You can put without. You can put it half sticking out, half under. Someone who's working out, for example, and the muscle has atrophied, depending on the age of the patient, when you dissect around the muscle, you're definitely going to be sore. So you cannot lift something up. But as far as moving your hands, your fingers, that's not going to hurt. So I say, and I leave it up to the patient, as long as you're not on the pain meds, your reaction time is good, and that you're able to be fast, because driving is all about reaction time, and you're as fast and quick to respond, then by all means use your judgment, and you can do it. So most of my patients, if I do operate on Tuesday, for example, or Monday, I say give yourself, do a test drive by Wednesday, Thursday, Friday. Definitely by Monday they're back at work, from my experience. So I saw just today one patient. She is a week out. She's smiling. She's wearing the pressure garment, which is very important. I have another patient that she's smiling here. So she felt very good driving in 3 days. And this was the patient that I put the picture up. And this was one of the videos. And I just put up the videos because someone said, what, can you please show how you do it? And this or that. And in it, I show my colleagues as to how I do it. Hopefully that helps you.
I have there's
Yes,
two other
please.
questions. Do patients have to sleep upright after the explant, and are there any sleeping restrictions?
So I say listen to your body. The one restriction that I have is you can walk, that should not be a problem, as long as you have a garment that's going to help protect and prevent the shear forces that will move the skin off the chest, because you want it nicely, tightly adherent. So no shear forces, because that will induce a seroma. Sleeping upright helps, because that's the gravity, and also helps with the breathing, if you ask me. But it is not, if anything, almost all my patients, and I think the ladies over here who have had the explant say they slept better the same night because they had less of a breathing problem, the chest weight, now they may have the soreness, but almost always they sleep better, and you can certainly sleep supine, i.e. flat, and it should not be a problem.
Okay. And then, will my breasts be uneven after explant?
So this is a good question. If you look at the anatomy, no two sides are similar. period. There's one is always larger than the other, but not a whole lot. But one thing I see is, you know, if you look at the patient that I had up here, or the patients that come, sometimes the patient has a capsular contracture on one side and nothing on the other side. There's much more swelling on the capsular contracture side, different pathology, different disease process compared to the patients on the other side who has had the implant, but there is no capsular contracture. So the swelling is going to be different. The tissue, the swelling, all of that is going to recede over the next several weeks and months, and it takes up to, if you ask me, up to 9 months to a year, just like a patient who gives birth, for the abdominal muscles / the subcutaneous tissue to normalize and equilibrate. So I say, but the gist of it occurs within the first 2, 3, 4 months, and it plateaus depending on. Now, most of the patients, if you look, who have implants, you can see the engorged veins, these green veins that light up. That's swelling. That's like the body going on overdrive. So I say to the patients, and this is a follow-up for your lift question, I say, you saw the big flaps. You want to put more scars over there? You read a review when you were up here on that patient. She was so happy. You know what she told me today? Thank God you didn't do the lift. I said I was not going to do it to begin with because I do not know when the skin retracts where and how it's going to settle. Because I don't want to do a lift and the next thing you know, it settles more and now you have a awkwardly placed nipple areola complex, which is a very, very hard problem to fix. Come back. Step 1, get rid of the problem. Step 2, come back another day. If a lady comes, and see this is very deep thoughts now, 21 years of age, large bilateral breasts, huge breasts, what they call, because of the hormonal changes, genetic. If you do a lift on her at 21, she's going to be back in her late 30s saying, I want another lift because of the gravity effect. It's only going to sag. Inevitably, unless you're on the moon, right? So this is what my boss used to say. So an honor and recognition of, and it's very true because now I was able to comprehend. So I say let it settle. When it settles, maybe you might not need one because you're young and 26 and it's going to retract, and guess what? The skin does retract unless you're postmenopausal and the skin has lost its elasticity, and it's going to continue to sag, come another day, and then do it. Defined, you come in and out. I have you on the OR table for 3.5 hours, 3 hours, 4 hours. One other lady was here for 4 hours on the table. I don't want you to be on the table for another 2 or 3 hours. That's 6 hours. Right off the bat, I'll tell you 6 hours or more on the table, you increase chances of DVT, deep venous thrombus, you got increased problems of infection. The goal is the Navy SEAL. You got to define operation, take care of business, come right out. Do it another day. And so that's my take on. Now, there are patients who get this concentric perioral lift, crescent shape. There are a lot of problems that come with it. Look at that. You want to go ahead and do it on that, and the next thing you know, you alter the nerve supply to the nipple. That's a big compromise. So you don't want to do that. All right? So the dissection is not as simple as it appears to be. And surgery is a very deep, thoughtful, and very sophisticated process. Every patient is different. I'll tell you to this day, when I go in and I say, I hope that, it's not going to be a challenging case like when I went in. It was a ruptured implant with a hematoma. When I came out, I felt like I need to sit down. I feel like I'm 80 years old, because I'm tired, the dissection, and it's mentally draining. That's why no one wants to do this end block business. It is, as you have heard from the other surgeons, it's a tiring process. Hopefully that answers the question. Okay. So thank you very much, everyone, for coming. Thank you very much to my audience, whoever you folks are. I hope you found this useful. I want you to please go ahead and talk about it. I apologize in advance if I said anything that may have offended someone. I will tell you I spoke from my heart, and again, from what I know, so that someone who got the implants and is doing well good for you, and hopefully you don't get this problem. If you do, and you know someone who needs help, get the assistance, because there is help, there is hope. 26 years is a long time. 26 years ago, I will tell you, I can only remember what I was doing, and so you have to basically, I was at UT Austin then. I was a Longhorn a long time ago. So you have to listen to your heart, what you're going through. And I say this: the patients are smart. You know what's going on deep down within. There's a problem. You use your gut instinct. Look at all these ladies that go in, I knew this was a problem, and they know. Now, you may be wrong, but you have to do the subset of problems, i.e. the checkup, make sure you're not missing something, and then you seek attention, and then by process of elimination, if you remove the implants, hopefully you solve the problem. All right. Thank you very much, everyone. I appreciate it.